and cestals, although we have acanthocephaly as well. But today we will talk and discuss about trematodes. Trematoda is a class within the phylum Platyhelminths. It includes two groups of parasitic flat forms, known as flux. Blood flux, or for instance, intestinal flux. And most of them are zoonotic, common between humans and animals. And humans can acquire the infection from the reservoir, natural reservoir, like, for instance, in this case, this is the first one, Fasciola hepatica, for instance, from the sheep, cattle, or the herbivores. Okay, trematodes are dorsoventral flattened. They are not tube-like. They are something like a leaf. And they have oral sucker, they have ventral sucker, and you can see here the unsegmented hermaphrodite. Males and females are not separated. And two radially striated suckers, incomplete digestive tract, like ceca, and most of the body is occupied by reproductive organs. You can see here, this is, for instance, testis, this is ovary, this is testis, branched one.
It is not showing.
Yes. Okay, the life cycle. Be careful that by looking at the picture of life cycle, you can understand easy many things.
Sir,
what is the source of infection?
Can you please explain the last line? Can you please explain again the last line? Previous
Slide the complete.
Last slide?
Yes, sir.
This one?
Yes, sir. Where are the suckers in this?
This is oral sucker, this is testis, branched one, and this is ovary. Okay.
So what is mean by incomplete digestive tract? What is mean by incomplete digestive tract?
No, I will talk about it later on. Because, you see, as you ask question, this is because if ceca, for instance, we have here ceca. This is ceca, okay? This is not something containing of the esophagus, intestine, and other one, and go to the anus. No, this is not. Because the absorption of this is the taking food from the cestals are through teguments and something. So they can get something from the oral sucker, but not this. This is just for attaching themselves to the host. Okay. Looking at the life cycle can tell you what is the source of infection, where the parasites are living, and what is the pathogenicity. You can guess it. What is the root of controlling infection, and what is the root of diagnosis. This is all are hidden in the picture of life cycle. For instance, here you can see that when you go to the slaughterhouses and you get the liver of the cattle, sheep, and infected other infected herbivores, you can see that this is the parasite. This is moving. This is moving, flattened parasites called fasciola. We have two fasciola, Fasciola hepatica and Fasciola gigantica. Fasciola hepatica is, you can see here, that this is shorter, but the margin is something not parallel to each other, and the shoulder is a bit prominent here. Here in the life cycle that you may have freshwater snails. Freshwater snails for completing the biological cycle of the parasite. You can see here humans are accidentally, like herbivore, get infection, and they are playing role even in the life cycle of the parasites and to distributing the infection in the environment. And you can see that you cannot stay in a desert area and expect to be infected with fascioliasis. If somebody comes from Yazd, for instance, from Iran, or Kerman from Iran, and talk about the prevalence of schistosomiasis or other snake-transmitted helminths, okay, this is something hard to understand. This is hard to believe. But if you are from, for instance, Iran, Mazandaran, Western Iran, Kashmir, I don't know, some parts of Lebanon, Pakistan, you can guess that yes, it could be happening. Although we have a prevalence rate of these infections in all these countries. So this is very important to take into account. And the important is that the adult worm are living in the bile ducts and in the parenchyma of the liver and in gallbladder, and the eggs are passing through the feces, humans and animals, no different, into the environment, and these eggs are inside these eggs. We can see the embryo, which is miracidia, ciliate one, miracidia, and it must be reached and close to the water. And then after the egg will be broken and the miracidia is out, okay? And then after miracidia, searching for first intermediate host, or for the intermediate host, not first. This is just, is something.
Yes, sir.
No, please let me.
It is written in which language, sir?
No, this is, forget it.
Oh,
This is,
okay.
forget it. I'm talking in English. Okay? No, maybe in the Spanish or something. Just, you have to look at the steps and the stages of the parasitic infection. So, the important is that these eggs will be broken and miracidia is free, and then after looking for snails, freshwater snails. Freshwater snails called Limnae truncatula. Limnae truncatula we can find everywhere. In European countries, everywhere. So, inside the snails, then we have asexual reproduction. That's the result of everything conclusively is the freeing of cercaria. Cercaria are moving objects that may called as the first stage of the parasite. Okay, it is looking for the host, and until then they must to attach themselves on the surface of the plants, white plants around the water. Nana, for instance. They can go there and attach themselves over there, okay, and become ready to be ingested by animals or human in cases. When they get, you can see that sheep, cattle, and goats can go for grazing. It's very easy to guess that they may get plenty of this metacercaria during their grazing. And the other humans, I cannot concentrate on that. Herbivores like cattle and sheep and goats, during the grazing, they get metacercaria, and that's okay. And humans, accidentally by raw vegetables, very smelling and very nice, delicious white plants, may get the vegetables containing of metacercaria. In the stomach and in the eating of the small intestine, the metacercaria become open and hatch, and the parasites is trying to penetrate the wall of the intestine, and then after go to the peritoneum and crowning up to closing to the Bowman capsule or liver, and try to penetrate the parenchyma of the liver and go through this organ to find the final step, final
Destination.
Residing area, which is the bile ducts and gallbladder. So this is something that you can understand from this part of the life cycle. And what is very important is that you can understand what is the pathogenicity. Okay, so all these accidents and all these effects can be seen in reticular endothelium, in liver, okay, and systematic and also local. This is very important. So, and if you want to diagnose, you have to go for instance, feces because eggs are over there, or for ELISA, fast ELISA to find the contagion of the parasite in the circulation. This is very important to know that all these study, all these information are hidden in the So here you can see that definitive host, usual host shape. I mentioned the usual host, and the habitat is bile duct, and also diagnostic stage. X is stool specimen, and also you can see the intermediate host here. Lignate truncatula. The size is less than 1 centimeter like this. Okay. I would also just emphasize on the right one. All the major systems are branched, I told you. Testis, ovary, and also vitellium. Adult fascicular hepatica approximately nearly 2 to 3 centimeters in length, and you can see that leaf-like one. For morphology again, this is your question, and you told me that what is the ceca? Okay, this is oral sucker, genital pore, okay, ventral sucker, uterus, ceca, branched one, lateral branch. This is ceca, and this is testis. You cannot see here a real anal pore for excretion. And you can see here fascicular hepatica, converging margin. Comparing with the parallel margin. This is the map of Iran, and I would like to mention one epidemic of fascioliasis in Iran nearly 25 years ago, 30 years ago. We had an earthquake in northern Iran, and after that we witnessed the cases of fascioliasis in Iran. Until then, it was just known as a veterinary importance. And one of the professors of mine, Dr. Masoud, and others, Dr. Yadegari, infectionists and others, were working on that, and on that time, according even to the international centers, we had not a real human therapeutics material for this, and it was just only in veterinarian drugstore for something like fascioliasis available. So they decided to use these materials by their own intelligence to treat the people. And after that, when I was in Spain, and the professor Santiago Mascoma, who is the most famous expert in fascioliasis, according to his team and also the others in Australia, they decided to work for triclabandazole, the treatment, the specific treatment for fascioliasis, and it was successful. So I'm showing you here the non-proteins and bordering the shore of Mazandaran, Mazandaran lake or sea, and also here you can see that all these signs that you can see on the map are belong to the northern part of Iran, and because of the environmental condition and snails and other matters that you can guess that the life cycle must be ready here.
Sir, these parasites don't have inner core. These parasites don't have inner core. Inner core.
Yeah.
So how the excretion of waste?
Excretory secretory. Excretory secretory. The tegment. It has something. It has something. In genital pore. In genital pore, they shed the eggs from the genital pore, and also they have something not really as anal, but this is something in the behind of the cecal, and you can excrete something. But as you may know, for trematodes and cestodes, the teguments, the skin of the parasites, are playing the role of digestive tract. So if you be in Gilan, Mazandaran, or northern part of Iran, a very beautiful area, you can find that Zeytun Parvande, for instance, is the best. You know that Zeytun Parvande is the best familiar food over there, and they may carry metacercaria by the white plants over there. So you can go there and you can see that, for instance, in the bazaar, white plants are offering to the tourists and to those who are spending their weekend or their vacations in northern part of Gilan. Okay, pathogenicity and symptoms, 50% asymptomatic. I'm talking about humans. Disease may appear anywhere from a few days to several years after infection. Eosinophilia is very important. You know why? Because we have tissue invasion. When the Cercaria and the young parasites is crawling in the peritoneum and accessing to the liver and trying to penetrate the liver and parenchyma to access the bile ducts. Okay, when symptoms do appear, they occur in the following patterns: acute or chronic, rarely seen in humans because of the large number of metacercaria may always ingested by animals, cows, cattle, sheep. But humans are occasionally get dishes of, for instance, infected vegetables to get 4 or 5 metacercaria. But this is not something to exhibit the acute symptoms as we can see in animals. Okay, if the number of the worms are plenty, be careful that in parasitology, mainly in herpetology, the severity of infection is directly related to the number of worms, which is said as worm burden. Worm burden is very important. By one worm, you may not suffer from all these clinical symptoms. But if the number of parasites are plenty, they will appear. Vomiting, diarrhea, urticaria, and anemia. And you can see in chronic phases, biliary colitis and biliary colic, abdominal pain, tender hepatomegaly, and jaundice. Yes. I would like to inform you about a very important terminology. Ectopic is residing a parasite in a place that is not normal and is not usual. When the normal place of Faciliosis. So, how we can detect the eggs to confirm infection? The stool examination is showing us the possible existence of the eggs in the feces of the patient. But if the worms are over there, but still they do not lay eggs, how we can diagnose? If the infection is in the early stage, that the juvenile worms are crawling and they are penetrating the parenchyma of the liver up to become adult, how we can diagnose? Serological test. So the eggs in stool examination is just relying on the adult worms that are laying eggs. This is the diagnosis. So direct stool examination, and the other one, serological test. This is very important to take into your account. The eggs are very typical, and they are more than 100 micrometers, so they are easy to distinguish when you are microscopically looking for parasites. The definitive and most widely used from the diagnosis is a directly absorbed feces. I told you that they must be adult. And serological are for time that they are penetrating the parenchyma. Eosinophilia is very important here. And inflammation signs and symptoms, systemic, is very important to drag your mind to the faciliosis. For treatment, I told you triclabandazole is the best and is the drug of choice for that nowadays. 10 mg per kg, single dose, is effective. So this is very important to take into account that before invention of this drug, the most focus of the clinicians were to treatment by signs and symptoms. How we can control faciliosis? Again, I would invite you to look at the life cycle of the parasite. Sheep, goat, cattle as natural reservoir host. They are moving around. Feces of the cattle, feces of the fish, of the sheep are in the grasslands. And if they are dried, no matter. But if they are in the water stands with plants like this picture, okay, the intermediate host is ready over there to get the melacidia and to produce cercaria. So, and cercaria attach themselves to the surface of the plants, and then after they can get all of them, and in cases, and also they can go for faciliosis. This is very important. Snake control, chemotherapy. Why chemotherapy is a part of control? Why? Because the source of infection is the source of infection is infected animal and infected humans. You have to treat them to prevent releasing eggs into the environment. Okay. The other one, the other next trematode is Dicrosolium. In my style, in my, let me say that I would like to talk brief of parasites in the first slide and then after go through slides. It's better because, as you know, brief information of the entire parasite, then we can better go for next slides. The important is that Dicrosolium dendriticum again is a liver fluke. You can find it in the bile duct, in the ducts of biliary duct, in the parenchyma, in the liver, and somewhere. But the size of the parasite is very smaller than the fasciola. It's maybe each on the surface of each fasciola you can put more than 100 or less 50 worms for 50 Dicrosolium dendriticum. Again, this parasite is zoonosis, and it's common between animals and humans, herbivores. And again, we have in the life cycle of this parasite snails as intermediate host, but not freshwater snails, terrestrial snails. Snails living in the soil like this discoid one. And if you can look at the life cycle as I recommended you for getting more information, you can see that this parasite is in herbivore and cattle and sheep, and the eggs are into the environment, and terrestrial snails like Pedicella are very prevalent in the soil, and they can get the eggs when they are going to find some food, and they get the eggs, and inside the snail you may have some developmental stage that finally by slime bile, which is the production of respiratory system slime bile, you can have you have this carrier over there. So this is something available out of the snail, ready for ants as second intermediate host. Ants are second intermediate host of the parasite. So they looking for attractive food, and they can get the slime balls, and then after cercaria become metacercaria in the brain of the ant, and the ants become paralyzed when they are looking and moving on the grasslands, and they can attach themselves over there, and then after being ready to get ingested by the sheep, cattle, and cows during grazing. This is very important. So the infective stage here, like the previous one, is metacercaria, but metacercaria is not on the plant. Metacercaria is inside the sheep, inside the ant. How we can eat ant? This is not by our will. This is not a willing practice of consumption to look and get the ants. No, but animals do that. For us also, in accidental cases, maybe infected part of the ant body is within the bread, cake, and something, or vegetables as well, and we can get them. So this is the route of infection transmission. And as we get this one, in the digestive tract, they again become hatched, and then after, not by penetrating the intestinal wall and crawling. They are just going forward and finding the ampulla water and become entered to the biliary system. So this is dicrosoliasis, and very important. It was two liver fluke infection. What is the condition? What is the epidemiological situation at the time being? Honestly, I have nearly 32 years of experience, and up to now, human dicrosoliasis, one or two cases I met. And as I told you in the early minutes of this session when all of we 4, 5, 6 were relaxed and talking about Rumi and something, and then after become aggressive like Changiz Khan and something some minutes after that. This is another lesson. This is another lesson that how you can get affection from the environment. But anyhow, this is just to tell you that you are all present, but the system was not standard. If we were talking about, if we were wanted to open class at 10, okay, they should ask me, okay, 11 is good, 11 to 1. Not 1 hour for just Salaam Alaikum and talk to, okay, and 1 hour for making everything. So don't worry, you are present, and let's continue with new approach. In the earlier, one of the best interests of mine with my students is looking parasites of ancient time. So one case I found in central Iran from the Iron Age around 3,000 years ago. And in cemetery we found a skeleton of human, and they could detect the eggs of the Clostridium dendriticum inside the cadaver. So it means that this parasite, the parasites are all of us older than us. And like the animals, fish is the first creature before all of us in the sea. And bacteria are even older than this. So this is the condition since 32 years ago till now. I could just find 2 cases in fresh samples, and in some parts of Africa, in some parts of Asia and Southeast Asia and South America, the cases are mentionable. And for Phaceoliosis, nowadays the cases are accidental in Iran, and we are not facing to epidemic picture. But in Chile, in South America, is very prominent, in Lebanon as well, in Kashmir, in some parts of Mediterranean region, we have plenty of cases. But this is not really a very serious public health importance. But we have to take into our account that transmission is easy, and we could be at risk of these parasitic infections. So these two was for the beginning of trematode infection. Now, it's better to concentrate on these 1, 2, 3, 4 parasitic infections. Okay? You are with me? Or out of class? Okay. Note this is important to take into account that schistosomiasis is very important. Schistosomiasis, please be with me, because I want to get a conclusion after the session. This is the problem of nearly 55 countries in the world. It's very important. What is schistosomiasis? The causative agent is schistosome worms. We have 3 main important famous schistosomes: Schistosoma hematobium, Schistosoma mansoni, and Schistosoma japonicum. Although I mentioned here as Schistosoma intercalatum and Schistosoma mekongi from Mekong. But these 3 are very important. So, what is the details These trematodes are, despite of the other trematodes, sexually separated. They have males and they have females. Females inside the males. Gynecologic groove is throughout the body of the worm, male worm, and the females are lying inside this groove. And when they become gravid, they go out and they go to the normal site of the worm, depending on the species of the parasite, and laying eggs, and everything is start when they are over there and when they are laying eggs. Okay, so Schistosoma hematobium, Schistosoma japonicum, Schistosoma mansoni, Schistosoma intercalatum, and Schistosoma. And when you see at the picture of this life cycle, again you can see that wherever we have river, lake, freshwater, lake, river, water stands, we are facing to these parasitic infections. If you go to Sahara, if you go to somewhere in Yazd, I mentioned in Zahedan, this scenario is nothing, so we are not enough concerned about this parasitic infection. And you can see that snails are here responsible for developmental stage of the parasite. Freshwater snails for Schistosoma hematobium is Bulinus truncapus. Plenty in Iran, in Iraq. Iraqi here? 1, 2, okay. We and Iran and Iraq, even nowadays, although we are in the eve of elimination and the post-elimination time, but I'm sure that in Iraq, still we may receive cases. So this is important. According to WHO, certificate of the elimination is just for those countries that even the neighboring countries are free from the parasitic infection. But just I mentioned in next slides that Morocco, for instance, has eliminated the schistosomiasis nearly 30 years ago. This is very important. Okay, so water, the lifestyle of the people, swimming in the water and somewhere, and you can see in the next slides. Okay, life cycle again. This is the parasite. Both all these three are separated, females and males from each other. The eggs of Schistosoma hematobium, terminal spine, the eggs of Mansoni, lateral spine, and the eggs of Japonicum, very circle one with a knob in the side. So this is important. And how we can go on to the picture of the life cycle, depending on the species of the parasite. For instance, if they are residing in the urinary tract, the eggs are found in the urine samples, and if they are intestinal one, they are in the feces of the patients. Just hematobium is in urinary tract, but Japonicum, intercalatum, Mansoni and Mekongi are intestinal one, so you have to look through the stool samples of the patients to find the eggs. But in Schistosoma hematobium, just urine sample can show the existence of the... Okay, the eggs are out. As I told you in previous ones, they are in the water, in the aquatic environment, and after some hours and some days, you can see that the eggs are broken, and Miracidia swimming are free, and then after go penetrate the skin of the snails and go inside the snails, and then after some times, the cercaria, in conclusion, they can shed the cercaria, which is in the left part. They are swimming one. They swim by these tails, by their tails, fork tails. They swimming in the water, and they look for a patient, for a vertebrate host to continue its living and also in biological process. They are waiting. It was again by one intermediate host, Bulinus truncatus, and they are looking for humans. For Schistosoma hematobium, the only vertebrate host is human, no more. So, as we are swimming in the water, as we are washing our dishes near the rivers, as we are going to the water stands for keeping ourselves from hot weather in the summer, they are ready to enter into our skin. So, intact skins are ready for getting the cercaria. Cercaria try to penetrate the skin of the people during the swimming, and they go inside the skin. The tail is cut, and then after this very, very young schistosome, which is called as schistosomul, may be formed under the skin and try to find circulation way to access to the liver and other blood circulatory system. Here, again, I'll show you that this is the picture of the life cycle, and here, Schistosoma hematobium, widely distributed over the African continent with a smaller foci in the Middle East, Turkey, and India. In Turkey is eradicated, eliminated. And in India as well, we can look for some cases. But Schistosoma mansoni, widespread Africa, foci in Middle East, Japonica Asia, mainly in China, the Philippines, Thailand, and Indonesia, and also Mekong in South Asia, and also intercalatum. As I told you, all of them except hematobium are intestinal flukes, so they can go for, they are targeting the intestinal vein, intestinal and digestive tract, and this is all. So, humans are the main reservoir of infection. Dog, cats, rodents, pigs, just for Japonicum and Mekongi are very important. And also, this is a picture that shows you that we can have some symptoms and very bad consequences of infection for hematobium into the urinary system. Maybe squamous cell carcinoma can be happen in the chronic phase of schistosoma hematobium in people who are infected with these parasites, for instance, for 10 years, for 20 years. Let me tell you that all these schistosomes the lifespan of these parasites are long. So this longevity of the parasite is another effective factor for producing malignancy. This is very important. Okay, this is here. This is the hematobium egg, Mansoni egg, and Japonicum egg. And also here, the shells, the snails of this parasite. Here, Bulinus truncatus for Schistosoma hematobium, Oncomelania for Japonicum, and Bionfanalia for Mansoni. This is just to remember. Very important slide. By this slide, you can get an overview of the epidemiological information upon this issue. Intestinal 1, Mansoni, Intercalatum, Japonicum, and Lecongai. for urinary schistosomiasis, schistosoma hematobium. And for the others aspects, I mean, by this, 53 countries of the African continent and in the Middle East are of endemic areas for urinary schistosomiasis. I told you that in this region, Iran and Iraq is two endemic areas for schistosoma hematobium for bilharziasis. Yes, this is the picture. Clearly, you can see that in Morocco is eliminated, and this is Iran and Iraq. By this picture, if somebody asks you, this is a picture, can you tell me what parasitic infection is in high risk here? Schistosomiasis, very easy. Swimming in this water stand, urine into the water, snails are plenty, ready, and cercaria are swimming to infect the others. So this is very easy to predict. This is the pictures of Iran. This is southern Iran, near the Khorramshahr, but unfortunately nowadays, because of rainfall and something, the situation is not like this. So this is something that changed since 20-25 years ago till now. But again, these places are ready to move, to transfer, to change the habitat of Bulinus truncatus, the intermediate host of the parasite. And this is near the river where all the people for spending their time and weekend can go to have picnic and something. So the condition for infection transmission is ready in Khuzestan. But since 2001 till now, my laboratory, as the referral national laboratory of schistosomiasis, has not detected even one case. 2001 till now, nearly 21 years, 22 years. This is a squamous cell carcinoma by the mechanical, excretory, secretory, and materials of the worms inside the urinary bladder. You may have, and also reinfection process that is very easy in hyperendemic areas, okay? You may have a squamous cell carcinoma, which in Iran we could not detect it even from the beginning of the occurrence until now. But in Egypt and in Morocco it was very mentionable on that time. So this is again to show you the consequences of this matter. I would like to read this. Acute symptoms, and dermatitis is the beginning step of the infection. Why? Cercaria are trying to enter to the skin. Dermatitis. Followed several weeks later by fever, chills, nausea, abdominal pain, diarrhea, malaria, and chronic symptoms vary with species but include bloody diarrhea for schistosoma mansoni and japonicum. For schistosoma hematobium we have hematuria. This is very easy to know. Intestinal schistosomiasis. Early on, intestinal mucosal ulcerations caused by schistosoma mansoni, japonicum, and meconiae, or interkeratom may bleed and result in bloody diarrhea. Again, hepatosplenic schistosomiasis, just these symptoms also can be expected in Schistosoma mansoni and Schistosoma japonica. For Schistosoma mansoni, nothing to mention more, but the adult lives in the blood vessel, mesenteric veins, and also you can see that mansoni worms reside deep within the mesenteric vein of the large intestine. For Japonicum, live in the mesenteric vein and exert eggs and circulate to the liver and colon. The eggs migrate through the intestinal wall and pass out with the stool. Again here, this parasite has a very wide host range, infecting at least 31 species of wild mammals. Japonicum, I mean. This is, so you can consider as zoonosis one. If somebody asks you what is the zoonotic one among these three, Japonicum is very clear for this description. For diagnosis, depends on the species of the parasite. For Schistosoma hematobium, you may have the eggs in the urine sample, and for Mansoni and Japonicum, you have to look for in stool samples. It's very obvious to detect the eggs. So, antibody and or antigen detection also is another route of infection transmission. Well, according to my experience, when our pioneers in Ahvaz were, I forgot to tell you that in Iran, in all provinces, this is not prevalent. And it was just limited to Khuzestan province, bordering Iraq. Khuzestan province. And in Khuzestan province, just in north of Ahvaz, in Desful and Shush and Shushtar. But we could not detect this parasite in Abadan. We could not detect this parasite in, for instance, Masjid or somewhere. The important is that you have to know that in this case, in Iran, Khuzestan province was the only endemic area, and in Khuzestan province also some parts of the province were not found infected with this infection. Anyhow, the sedimentation method was very familiar to all of us. The urine sample from the school children in the villages, and they brought the samples into the laboratory in Ahvaz and put on the table in the laboratory for 2 hours, and then after get the sediment of the urine and found the eggs very, very easy, very characteristic, because they are around 100 micrometer length and terminal spine. This is all I have to tell you here. The treatment, praziquantel, 30 milligram per kg, 3 times a day for 3 days. Cure all. This is very reliable for treatment of schistosomiasis. Control measures. Again, I would invite you to look at the picture of the life cycle. You have to control for snails in the water stands by controlling the aggregation of the snails and to transferring the snails to somewhere else. Okay, this is very important. Public health education, not to urine into the waters, not to touch the water when you are not aware enough about the safety, and to know that the sanitation and building the toilets are very important. And this is something that in endemic areas, governments are very, very involved in this reduction of infection rate by taking a decision to expand the hygiene and environmental hygiene better than the past. And mass chemotherapy. Mass chemotherapy is a very useful step when you want to demolish the source of infection. The eggs are inside the humans. When you treat the humans, okay, the eggs are not in the urine and nothing. You may have millions of Bulinus truncatus in the environment, but if there is not any egg to be penetrate the skin of the snails and go on, okay, nothing. This is very easy to predict. Okay, I would mention two or three rare trematode infection. Rare trematode infection. This is not rare because this is rare because we are talking about this parasite in Iran. This is something related geographically to the endemic and non-endemic area. But I would like to talk about Trematodes sinensis, Chinese liver fluke, Oriental liver fluke. Lifespan is 20 to 30 years. Take into account, to consider, regard that when you are dealing with a worm inside the liver of a patient with 30 years of lifespan, how can be there? This is very important pathologically. Anyhow, look at the picture. You can see here that the eggs are out. We have to continue the life cycle into the freshwater snails, Cercaria in the final release here, and what is important is they have to go inside the muscle of the fish, and metacercaria may get formed inside the muscle of the fish. So the second intermediate host is fish, and humans get infected by consuming the undercooked or not well cooked fish dishes, and this is very important. Through after that, they may release from the muscles, digest, and then after go through the ampulla water and go and get access to the biliary tract. This is very important for Trematodes sinensis. Okay. Liver fluke, Trematodes sinensis epidemiology. Transmission is due to consumption of raw, undercooked fish and salted and dried fish. Be careful. In some places, in India, for instance, in Pakistan, I know that in some cities, we can find dry fish, very small one, and to eat it. Maybe they carry them to Cercaria. If the process of making them is very recent. So, over 13 million people are infected in Southeastern Asia. This is not a parasite infection for Pakistan. Don't get confused. I'm talking about the examples. So, no reported cases in children below 10 years old. And also, China, Japan, Korea, Vietnam. This is for Trematodes sinensis. The host, the range of the host is broad. Multiple species of snails are involved as first intermediate host. If it was a whale, I would not promise to stay here. I would talk around this way, and also 100 species of freshwater fish. 100 species of 100 species of freshwater fish. They are responsible as, playing as second intermediate host for Clonorchis sinensis. Okay, this is very important. Also in China, shrimp can carry metacercaria, but you see here, this is not comparable with the prevalent finding of metacercaria in fish, comparing with the shrimp here. And also, I would like to tell you that, again, you can see that, do you know what is Piscivorous? Piscivorous animals or piscivorous animals?
Yes, sir. Fishes.
Yes, fish-eating animals. Fish, like birds even, cat, dog, jackal, and so on. So this is also important to tell you, and can serve as definitive host. New scenario?
Five breaks.
Liver fluorochemical detection of parasite egg in stool. No, please. Immunoassay, and for treatment, praziquantel is the best drug. I will give you these slides, but
thank you, sir.
Design it, and maybe tomorrow, or when you are in practical class, I will give you these slides. Okay, but the important is that praziquantel is the drug of choice for Clonorchis sinensis. Don't worry, just 2 parasites left. Opistorchis. Not, this is half an hour, I want, no, 20 minutes, but if you tolerate with 20 minutes, it's okay. Otherwise, I have to keep you here, close the door, and keep you up to 2 or 3. Don't worry, I can do that. Viverini, the Opistorchis, some other species. Please, believe me. Opistorchiasis is a parasitic disease caused by certain species of genus Opistorchis, Viverini felineus. And also, chronic infection may lead to cholangiocarcinoma like Clonorchis sinensis. This is very important. Okay, here, cercaria are released from the snail and penetrate freshwater fishes, okay? Encysting in the muscle of the fishes, okay? And this is very important. And mammalian definitive host may get this fish undercooked, raw, or you cannot ask the jackals, okay, please jackals, give this material enough cooked and then after. But for the people, it could be informed through the educational health education that you have to get enough cooked fish in the endemic areas that you are at risk of acquiring infection. Anyhow, this is after ingestion, the metacercaria exists in the duodenum and second ascend through the ampulla, the water, okay, and everything will be start over there. Geographic distribution for Opistorchis is found mainly in northeast Thailand, Laos, and Cambodia. Okay, this is very clear. And this is the last one. Why I put this one as the last one? Why? Why?
Because it will take less time.
Because we had it in Iraq. In Iraq, I'm sure that in Iraq we had it.
In Pakistan.
Even now in Iran maybe we have it, but we need to get enough sample, and in India, in Pakistan, definitely. But why? in the next session that I'm here, before that I write a letter to the dean of the university and to the dean of the campus. If you go in an unknown area, for instance in Kashmir, you go to the bazaar and you see that in that place some vendors are selling very fresh fish taken 2 hours, 3 hours from the sea. You have to know that there must be something among the people prevalent. If you go concerning the fish-borne parasitic infection, if you go to Khuzestan, Susangerd area, I have been there many times for field study of the students. It is very important. If you go there, you can see the lady are vending the fish near the road, and you can ask them how we can cook it, and they can exactly tell you that please do not cook it very well. This is very delicious if you deal with this dish like this. So, in Khuzestan, I remember that one of these PhD students graduated 20 years ago under the supervision of one of my professors, Dr. Masoud. They got nearly 4,000 stool samples random among the villages. They found 8% of the people infected with heterophius, causing heterophiasis, intestinal flu, size very small. Even the adult worm, you cannot find it into the petri dish. How we can find the eggs? The eggs are very small, nearly the below of 20 micron, nearly 20, they're below the 15 micron. So how we can find it if we have not enough informed about and we are not enough experienced microscopically to find the eggs. So, what is the scenario? The eggs may lay by humans, infected humans. Plenty of worms are inside the intestinal tract, or by other fish-eating carnivores and birds. Okay? They are laying eggs. The eggs are available to the freshwater snails. Melanoides, melanopsis, very prevalent over there. And then after, you may have Cercaria. Cercaria become encysted inside the fish, okay? And we get the fish for kebab or something. And we get Metacercaria. Inside the intestine, after the digestion, you may release the Metacercaria, and the very, very young adult worms by their suckers attach themselves to the epithelial surface of the intestine, and this is very one of the very dangerous consequence of this infection is not diarrhea just, although we have diarrhea and vomiting and something. But because of the very small size of the eggs, you may have a very bad scenario at the end that the eggs can penetrate and enter to the to the blood circulatory system, and they approach to the valve in the heart, and also become granulation over there. And then after years, maybe the people are suffering from some cardiovascular disorders and matters, so they go to the cardiologist and also go to the cardiosurgeon and solve their problem, but nobody knows what was the cause of this matter. So, because of this, I put an exam in front of my PhD student and MSc students in Ahvaz when I was over there some years ago, and I found a jackal roadkill jackal on the way and brought that with ourselves to the laboratory and dissected and found that it must be infected with heterophius. They were going for rest and eating dinner and something, and I asked them, okay, who wants to know what was the result of this jackal, roadkill jackal can come down to the laboratory? And they searched. Nobody can find the eggs and the adult one, even one, except one of them. And it was telling me that these parasitic infections should be well trained, the people should be well trained technicians and parasitologists in endemic area concerning the specific parasite that could be available over there. This is very important. So, but don't worry, if you go to Khuzestan, very delicious food we have over there, very delicious fish we have over there, but try to make the slice a bit thin, and then after well cook them and eat, and don't worry, okay? So these people who can help me, who can help me for